Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Shoshana Hershkowitz, the campaign manager for the Empire State Campaign for Childcare and the Schuyler Center for Analysis and Advocacy. Shoshana, welcome back to North Country Matters. At long last, we have a New York State budget, and you're here to tell us about the good, the bad, and the ugly.
Yeah, it's been a long road.
Well, let's talk about the good news first. What was in the budget for families that are concerned about early education and childcare?
So some things that are good, not necessarily strictly tied to childcare, but the expansion of the child tax credit, which increases the credit for children ages 4 and older from 3 to up to 330. It provides 1,000 annually, up to 1,000 annually for children under the age of 4. A really, really great thing, something that is very close to my heart, is establishing universal school meals for all children across New York. And this is really huge because it has really varied from across, New York's got almost 700 school districts. It has varied from district to district. And this really makes sure that every child is going to school with something in their belly. And we know that this is incredibly important for their learning, for their well-being. And it is an economic and time relief for parents. So it is really, I think, one of the best things in this budget. It's great for families, it's great for kids, it's great for education, establishing the housing access voucher program, and then some other things like the 50 million for hunger prevention and nutrition assistance and Nourish New York. There's $8 million for baby benefits for new families to provide postpartum care packages. And then as far as childcare, there is an additional 400 million in the budget for the child care assistance program. So, and also now who is eligible has increased. It's now about, I think, 111,000 or 113,000, something around that ballpark for a family of 4 in New York. So many more people will now be eligible for child care assistance, which is huge. There's 100 million in capital funding for child care centers, for expansions, for new centers, and there is the establishment of a child care substitute pool. So all of these things, and I will say that for me, the one that really I think is the biggest is the school meals, because kids and families will feel that every day that their children are in school. That is just, financially and also time-wise, when you think about it as a parent, you're like trying to get, yourself out the door, your kids out the door, you're packing lunches. This now will put money and time back in families' lives.
And let's face it, time is something that we can't get back. And so anytime we can save a little bit of it, it just goes to make the quality of life higher in New York. One thing you mentioned the child care substitute pool. That would only work if we had enough child care givers to in the first place, wouldn't it?
Yeah, yeah. I mean, I think that our efforts should be on recruiting and retaining a child care workforce so we don't have empty classrooms. And again, while it's wonderful to improve upon centers and build new centers, if you don't have a child care workforce to work in those centers, you're just going to have more empty classrooms. So that is, I think a real issue and shortfall of this budget.
Yeah, and of course, even the subsidies, the fact that they put money into the subsidies doesn't help if you can't find a slot, does it?
Right. Nope, not at all. So even if you've got the voucher, if there's nowhere to take that voucher because there are closed classrooms and places not operating at capacity simply because they don't have the staff, then you're still stuck as a parent.
You are. So that's the good news. Now let's go to the bad news. What wasn't covered in the budget that you and the Empire State Child Care Council were hoping for, at least during the budget session?
The biggest thing is the fact that there is no additional money for the workforce. And we know that childcare educators are amongst the lowest paid workers in the state. I think on average, they make $39,000 a year, which is not a living wage, not a living wage anywhere in this state. And we were looking to establish a permanent workforce compensation fund that put additional money in the pockets of the workforce. So that way it is easier to stay in the job. It is easier to recruit and retain workers, which then would increase the capacity so parents wouldn't be sitting on wait lists. And this is the first year since the pandemic that there is no additional money for the childcare workforce. So this is something that is really disappointing, something that we pushed hard for and did not come through, and it is something we will continue to fight for.
You know, and of course, a lot of that pandemic money was actually federal money. So when that
Yes.
dried up, and the state can't pass along what it doesn't have. And in order to put more money into it, they would have had to dedicate state dollars to go there. And apparently that just wasn't a priority this year in the governor's budget, was it?
No, and it was not a priority in her executive budget. The Senate did put $500 million in their one house budget for that child care workforce. And our hope is that when this is done, it will be permanent. So we're not going back every year fighting for this, because to stay in a profession, you have to have a sense of knowing that you're not fighting year to year. You have to know that the money is there. And this is absolutely doable. We've seen it done in other places. DC did this a while back, and it really did make childcare, it made it better there. You can't expect people to go into this field and stay there for the long haul if you don't pay them what they deserve. And that's what we're working on, and we're not going to give up on this.
That's right. And not only that, but if you want an educated workforce, then they have to be able to pay back their student loans. And right now, they're not making enough to do that. And with the student loan system restarting now, it's putting people under the gun in terms of not making very much money and having to repay loans in a field that is not remunerating them for their efforts in their education, is it?
Right, absolutely. And, we're saying that we are prioritizing the education of children, but, it seems that the state and the federal government does not seem to understand that learning doesn't begin when they walk in the door at pre-K or kindergarten. It starts, those first few years are where the bulk of brain development is happening. And if we are not giving kids the best possible early learning experiences, then there is so much work to do on the other end when they're in the K through 12 system if we're not starting early. So if we care about kids, we should be investing in early childhood education, and that means also investing in the workforce that is doing the educating.
That's for sure. So one of the things that there is money for the child care assistance program, but some of those programs were running out of funds before the state budget passed. And it wasn't just in New York City. There were some rural upstate counties that also didn't have enough. Is there enough money in the pot now, do you think, to fund child care assistance for the next budget year?
No.
Okay.
No. What it looks like is that 350 million of that is targeted for New York City, where the bulk of the children who would be impacted are, but it is conditional upon matching funds from the city. So that's going to, and the city is now working on its budget, so that is going to be a back and forth. But as you said, I believe it is now up to 15 counties that have closed enrollment. And that includes upstate counties. I think one of the first ones that we were hearing about, I think was Warren County. So this is not just a New York City issue. This is happening all over the state. And there was a report from the Children's Agenda out of Rochester that basically said if the trends continue the way they are with the number of people who are eligible applying for the child care assistance program, that by 2026, almost every county in the state will be out of money as far as new enrollment. So this is trending in a really not great direction, and the state is going to have to step in and put the money in. So while the 400 million is certainly welcome and needed, it is not going to cover this for a year.
Okay, so that's really on the bad news side then. And lastly, what about children with special needs who have been shortchanged right along? Was there anything in the budget about addressing those needs?
I would need to go back and double check that. Nothing stands out that I remember as it being earmarked.
Okay. Well, now we get to the ugly. As we know, a lot of the state side funding is driven by federal dollars, and the federal side is chaotic, to say the least, under the new
Yeah.
administration. Governor Hochul has already warned the state legislature they may have to come back into session if the federal picture changes dramatically. So what are the dangers for the child care industry in New York if the federal dollars really change significantly?
So one of the things that jumps out at me is that many child care providers are themselves on Medicaid. So should that Medicaid funding be cut, you are now harming the health care of the people who are caring for our youngest New Yorkers. So that is one thing. Um, Also, yeah, I believe it is like 44% of New York's children are covered by Medicaid. And the cuts that they're talking about, you cannot keep services the same and cut $880 billion from Medicaid. And that is not reform. It's not, getting rid of waste and abuse. It is taking healthcare away from millions of people, including New Yorkers. Um, the other thing that I'll say is that they're looking like they are seeking to punish states that use their own state dollars, which is part of states' rights, to cover undocumented children. So that is something New York has chosen to do because every child should have health care, regardless of immigration status, because everybody gets sick. Um, and so that is another issue. This puts a lot of kids and their families in jeopardy.
Well, one of the things that we've seen in some states, but Texas comes to mind, is with the measles epidemic. I mean, public health is public health, and we either take care of everybody or everybody starts suffering if we make big bad decisions when it comes to public health. So cutting Medicaid hurts a lot of people directly, and it's going to hurt a lot of other people indirectly as some of these uh, diseases get a threshold in a community, isn't it?
Absolutely. And I think that if we learned anything from COVID, and maybe people have forgotten, but public health, we don't all operate in silos. COVID, so much of COVID was about what are we doing for the collective good? How are we, when we care for ourselves and, we have to think about how are we impacting others. So I don't think we can look at Medicaid and say, well, I'm not on Medicaid, so this doesn't impact me, because when your community suffers, you will suffer too.
That's
And there's no community that will go untouched by this.
that's right. And I remember reading some time ago from someone who was very knowledgeable in public health who said, public health saved your life today. You just don't know it.
Mhm.
So,
Yeah.
and one other thing that our state budget called for was 10 million in federal funds for family daycare building renovations. And if that doesn't come through, then those renovations won't happen, will they?
No, that's a whole other issue. There's a lot of uncertainty
No.
with this budget, and I think that I would not be surprised if we are, if the legislature is called back into session to
Mhm.
deal with whatever comes out of the federal budget. These are really uncertain, difficult times.
They are. So there's a handful of weeks left in the session. What actions do we need the legislature to take to fill in the blanks that the budget left? Because there are always unmet needs, and some things the legislature has done year after year, and if they haven't passed through the governor to get signed. So what's left to do that we would like the legislature to tackle before they end in June?
So some of what we are working on, we are looking to, we have a bill number for that permanent workforce fund. We are looking to get legislators who have supported this on the record as co-sponsors of this legislation, which we will reintroduce in the budget next year. And we want to come back with a really strong showing of legislators saying, hey, we support the child care workforce, because quite a few of them said this was that the $1.2 billion investment we asked for this year was needed and necessary. So now we're asking them to help us gear up for that for the coming year. We're also there's a wait list bill, because we know that with the CCAP, the Child Care Assistance Program shortfall, with the shortage of workforce, there are people on waiting lists for child care centers. So, and for just child care in general. So there is a wait list bill that we are working on. And we're also asking for reimbursement rates to be raised so for the child care workforce, because that it would, provide some dollars in their pockets.
What about the minimum earnings requirement? That that got passed last year but didn't get signed into law. Is that something you're going to be trying to work on in the next few weeks?
We are going to be leaving that for now. We think that both that and the decoupling bill have an easier chance of passing in a budget than they
Okay.
do because the governor vetoed both because of what she believes is a fiscal issue.
Okay, so that makes sense to try again next year. And since the budget season seems to be protracted in the
Yeah,
last few years, there should be time to work on some of these issues, shouldn't there?
yeah, yeah. I mean, this is such a short. That was another part of why, we really had to adjust our expectations because, we are 4 weeks away from the end of session.
Right. And I saw just today that the Assembly has added 3 days to their work calendar because they already know that they've got a lot to do and they didn't have enough days left in session to do it. So that is hopeful that at least the Assembly is thinking about making sure they have time to get their work done before the
Yeah,
end of session.
yeah.
So one of the things that we always talk about, and there's kind of never seems to be a perfect answer to the question, is we are desperate for people to provide childcare, and we have plenty of people who want to provide it, but they can't make a living wage in this very important work. This budget misses that goal again this year. What do we need to do? Who do we need to talk to? How do we advocate for that very important part of our workforce which just can't make a living?
Well, I think that we need to hold the governor to her word. She had a task force that laid out a path to universal childcare in New York State. And workforce and paying the workforce and recruiting and retaining a workforce was their first recommendation. So we need the governor to listen to her task force. And I know she has convened another one with like business leaders and unions to bring them on board. So I think that at this point, we need them to listen to the people who have laid out a path for this. If the path is there, it costs money. And I think that, people are going to have to accept that this is going to cost money to get it right, but it costs more to not do it. And I think that the longer we delay this, the more people you have choosing between childcare and rent, or saying, well, maybe I'll, only work part-time, or maybe I won't work at all. And it creates a real instability for families, for communities. It creates instability economically. So it's time to make this investment, and there is a blueprint for it. We just need the governor to listen to the recommendations of the task force that she convened.
Well, that sounds very reasonable. We just have to hope we can make it happen. So let's take a minute, Shoshana, to talk about the Empire State Campaign for Childcare. How does that work? How can people join that effort and, provide more support and more voices asking for the things that you folks have identified?
So we are the state's universal child care campaign. Many of our members were on that governor's task force, the child care availability task force, advocating for a universal system that is where it's treated as a public good rather than this private burden that each family has to endure. And one thing I want to point out is that a lot of times we look at childcare as birth to 5. We're also talking about childcare really extends through about 12 years old. We're talking about summer care, before or after care, people who are working non-traditional hours. So we're thinking about, really birth through 12 when we talk about this. Although we were focused on the early years, but we are including all of it. And one of the things that really struck me is when we were talking about the child care assistance program, I spoke with a parent in Buffalo who talked about how they used the child care assistance program for summer care for their school-age children. And this is a single parent who said, without this, I don't know how I could have worked. So, this is one of those things that really, I think sometimes people think, well, once my kid is school age, childcare is not a thing for me anymore. And that's simply not true. I think any of us with kids, school age kids, know that being a working parent during the summer there's a whole level of stress there. So, we invite people to join us. Our website is empirestatechildcare.org. Check out what we're doing. We have committees. We'd love to have people join. and really start to advocate with their state legislators, really start to talk, at county meetings, county legislatures really talking about, well, how is this money that's coming down to the counties? How's it being distributed and used so that way people are getting the most out of their government and getting the
One of
most services?
one of the federal programs that has been talked about lately for cuts is Head Start. Head Start provides a really critical
Mhm.
piece of the child care in New York State and in everywhere. And there's been a lot of advocacy around making sure that Head Start doesn't get cut in the new so-called skinny budget
Mhm.
because of the impact on parents. So this advocacy is not just at the state level, is it?
No, no, not at all. What we know so far about Head Start right at this moment is that they have downsized the offices. So, like the regional office that New York was a part of was closed, it's been combined, and a lot of the people who are staffing those offices have been let go, which means that it's going to be more difficult if you've got questions to have them answered. It's going to be more difficult to get that money from the federal government out the door to those Head Start programs because there's a workforce shortage, which means that it's going to impact those local centers. So that is advocating with your members of Congress, with your senators at the federal level is going to be equally as important because again, this attempt to really gut the social safety net at the federal level will be felt in local communities.
It certainly will. And every one of the issues that we talk about, whether it's SNAP or
Mm.
um, school meals or childcare, they're all quality of life issues. And if these programs disappear or are cut out of existence or can't be functioned because of too low in the workforce, it's real people who are being hurt and real
Absolutely.
children who are being hurt.
Absolutely. And you have to ask, why are they cutting from some of the people who need government to work for them the most to give tax breaks to billionaires and corporations? It's unjust.
Well, it's inexcusable, is what it is. And the fact that it's only seems to be billionaires now who are making these decisions, these are not programs that they rely on. They're not
No,
programs that their families rely on. They have no real knowledge of them. And for them to say it's waste, fraud, and abuse, it's not from a knowledge base.
no. And what it does is continue to perpetuate that being someone who is low income is somehow a moral failing when it is actually a failure of a system. There is no crime, there is no moral crime in not being wealthy. And they treat this as if it is. And truly, it is a systems failure.
I'm always reminded of the Charles Dickens line, "Are there no workhouses? Are there no prisons?" I mean, really, what we have to take care of people, and we should want to take care of people, and especially for the young, they're going to be taking care of us someday. And do we really want a substandard education for the future people who are going to be doing the work? I don't think so. So thank you, Shoshana. Any final thoughts to leave us with as we wrapped up here today?
I think that it's if you are someone who cares about the social safety net and our social contract with one another, this is a really hard time. But I think the only way out is advocating and standing in solidarity with one another through it and making sure that we're showing up for one another, even if it's not touching you directly at the moment. I don't receive Medicaid, but I will go out and advocate for saving Medicaid because it impacts my community, and my community will be worse off if someone can't get the health care that they need. So I think it is about understanding that this only works if we show up for one another.
You're exactly right. And what we have learned the last few years is that caregiving crosses the entire lifespan, whether it's childcare, whether it's medical care, whether it's care for the elderly, we're all pieces in that machine, and everybody either needs to get care or give care at some point across that continuum. So we need, as you say, we need to show up and we need to continue to advocate, even if it isn't for our family or ourselves, it's for somebody who matters.
Absolutely.
Well, thank you, Shoshana, once again for coming in and talking about these very difficult issues. I wish it were better news, both at the state level and the federal level. We still have time at the federal level to make an impact, though. And so, you know, we will urge people to continue to do that. And I'll put the information about the child care campaign in the show notes so that people who want to advocate through your organization will be able to do that. Thank you for being such a strong voice and for continuing to work on these issues and for being willing to come in and talk about them with us.
Anytime, anytime.
Oh, well, I will take you up on that, my friend. These conversations are a production of North Country Matters. This show is a civic collaboration between the St. Lawrence County League of Women Voters and the Potsdam Public Library. Until next time, remember, our North Country matters, and so do our children.